Okay, I think we're going to go ahead and get started. Well, welcome and thank you everyone for attending the launch of our new report, State Strategies for Sector Growth and Retention of the Direct Care Health Workforce. I'm Shelby Hockenberry, and I'm the Program Director for Healthcare Delivery at the National Governors Association. We have some wonderful speakers lined up to share insights on the direct care workforce and highlight pieces of our paper. Please feel free to drop questions or comments in the Zoom chat throughout the event. We encourage discussion and exchange of ideas during the event and hope we can facilitate a dialogue among participants. We're grateful to everyone for joining us today for this discussion, as we know you are all busy and appreciate you sharing your time with us to focus on an incredibly important issue states are facing in the direct care workforce sector, which has only been exacerbated by the COVID-19 pandemic. I'd like to briefly introduce the direct care workforce team at NGA. This team is a cross collaboration between the healthcare delivery team and the post-secondary education team, which in addition to me includes Amanda Winters, Program Director for Post-Secondary Education, Tony Cotillo, Policy Analyst on the healthcare delivery team, and Jess Kirchner, Policy Coordinator for the post-secondary education team. I'd also like to take a moment to introduce our consultants on this project from Veritas Health Solutions, Dr. Hannah Maxey and Courtney Medlock. They have been crucial partners providing insights on the healthcare workforce based on their years of experience working on these issues at Indiana University and nationwide in their work as consultants. They were instrumental in producing both this report and our event here today. We are very thankful to have their participation and would not have been able to do this without them. So thank you. Big kudos to you, Hannah and Courtney. I also want to quickly review our agenda today. So we'll start with a welcome and introduction to NGA and the work of the Center for Best Practices from our Center Deputy Director, Ryan Martin. Next, we will have an overview of NGA's partnership with the Health Resources and Services Administration, HRSA, from Public Health Advisor and NOSLO Project Officer at HRSA, Kathryn Brothers. We'll then briefly frame our resource, highlighting how governors can approach direct care workforce retention and the sustainability of the profession overall. After that, we will watch a short video on the national direct care landscape from Dr. Alice Bonner at the Institute for Health Improvement. We will then turn it over to the field perspectives from our friends in Minnesota and the National Center for Assisted Living for their presentation videos, followed by a panel to discuss the issues presented here today. Also, please note that following this event, remarks on the national landscape of the direct care workforce from Dr. Bonner and from the field perspective discussion videos will be uploaded to the event page. And I will note that we were expecting to also have a representative from Missouri today, but instead I believe his video will be uploaded on the event page as well. Unfortunately, he was unable to join us. We know that Zoom fatigue is all too real and competing obligations may exist, but we do encourage everyone to have your cameras on and ask that you stay on mute when you're not speaking to reduce excess noise and distractions. And now I'm pleased to introduce Ryan Martin, Deputy Director of the Center for Best Practices at NGA, to begin the webinar. Ryan, over to you.
Great, thanks, Shelby. Glad to be with you all today. Thanks for joining our meeting to discuss state strategies for sector growth and retention of the direct healthcare workforce. My name is Ryan Martin, and I'm the Deputy Director for the Center for Best Practices. Founded in 1908, NGA is the voice of leaders of 55 states, territories, and commonwealths, and these governors are dedicated to finding solutions that improve their citizens' lives. The Center for Best Practices works with state policy leaders and other experts to foster sharing between states and help them research, develop, and implement innovative solutions to public policy challenges. The Center for Best Practices is made up of 12 different policy teams, and Shelby leads one of those health teams. And the project we're discussing today brought together our healthcare delivery team and our workforce development and economic policy team to collaborate. I should say actually our post-secondary education team, as well as Amanda has been joining us as well, to collaborate on pressing issues related to direct care workforce, especially in light of the recent pandemic. The paper and event were made possible by funding from HHS, the Health Resources and Services Administration, and NGA is grateful for the funding they have provided over the course of many years to research and report on issues related to healthcare workforce in the states. The partnership allows us to help states better understand successes and failures of various policy approaches and work to improve outcomes on different health policy matters. We're also grateful that we've been able to investigate pressing issues facing direct care workers, which have obviously only been exacerbated by the COVID-19 pandemic. Direct care workers provide essential services for adults, as you all know, and those affected by disabilities, individuals in rehabilitation facilities, or even in home-based settings as well. And these are core essential workers that provide an array of important care and services to so many people across the country. This paper lays the groundwork for states, and specifically governors' offices, to facilitate collaboration among the states and break down some of the silos that keep them from better coordinating these efforts. This paper also provides a number of successful state examples that other states can model as well. NGA will continue to bring states, relevant agencies, and key stakeholders together to share innovative policies that can help address these direct care workforce issues. And with that, I'd like to introduce Kathryn Brothers, who's a public health advisor and NOSLO, which stands for National Organizations of State and Local Officials, for those not versed in that acronym. She's the project officer overseeing this at HRSA, and she's provided leadership and guidance to our work on this paper. Kathryn, I'll turn it over to you.
Thank you, Ryan. Next slide. And good afternoon, everyone. And I'd like to thank NGA for inviting me to share some opening remarks with you about the Health Resources and Services Administration, or as we're commonly known, HRSA. NGA and HRSA have a relationship that spans decades, and I am pleased to be here today to continue supporting this important partnership. Next slide. As you may know, HRSA provides healthcare to people who are economically, medically vulnerable, or geographically isolated. This includes people living with HIV/AIDS, pregnant women, mothers and their families, and those otherwise unable to access high-quality healthcare. HRSA awards nearly 90% of our budget through grants and cooperative agreements to approximately 3,000 awardees. This includes community-based organizations, colleges and universities, hospitals, private entities, and state, local, and tribal governments. HRSA also supports the training of health professionals, the distribution of providers to areas where they are needed most, and improvements in healthcare delivery. In discussing workforce needs and challenges, we find critical alignment with HRSA's strategic goals of improving access to quality health services and fostering a healthcare workforce able to address current and emerging needs. We know that a sufficiently skilled and sized direct care workforce is critical to ensuring access to care, especially for older adults and people with disabilities. Recruiting and retaining direct care workers and developing career pathways to other jobs in the health sector is necessary to ensure a workforce that can meet current and emerging needs. Next slide. There are many ways that HRSA works to improve health outcomes, particularly for vulnerable populations, but I'd like to talk about HRSA's Health Center program. This provides access to high-quality, family-oriented, comprehensive primary and preventive health care for people who are low income, uninsured, or face other obstacles to getting health care. Today, HRSA funds nearly 1,400 health centers, operating almost 13,000 service delivery sites in every state and territory. HRSA, nearly 30 million people, or 1 in 11 nationwide, rely on HRSA-funded health center for affordable, accessible health care. That's 1 in 8 children and 1 in 5 rural residents. During the COVID-19 public health emergency, health centers have played a key role in providing testing and care for those affected by the virus. HRSA has awarded new funding to support health centers and health center program lookalikes in the detection, prevention, diagnosis, and treatment of COVID-19. And the pandemic has also put a spotlight on longstanding challenges in recruiting and retaining individuals in direct care, entry-level healthcare jobs, particularly with aging and disabled populations. We also know there are barriers to recruitment and retention during the COVID-19 pandemic that have been further exacerbated, particularly a need for direct care workers. Next slide. This slide lists a few of HRSA's current program activities, such as administering the Provider Relief Fund, which was initiated as part of the CARES Act. And if you have any questions about these activities or any HRSA program, please reach out to me or contact us through NGA. Next slide. In closing, I wanted to quickly mention that HRSA has 10 regional offices that work directly with states on the ground. To contact a HRSA regional administrator, you can visit the website on the link on this slide. Thank you again for the opportunity to be here today and provide these updates.
Thank you, Kathryn. We're so appreciative of your guidance and leadership on this work and all of our projects funded by HRSA. We appreciate the opportunity to do this important work with you. I also wanted to note before we continue, in case I neglected to do so at the outset, that this meeting is being recorded. As I noted, several of the videos and the discussion panel will be uploaded to the NGA website for further viewing in the future. Now we will have a video presentation from Dr. Alice Bonner at the Institute for Health Improvement.